And thanks for having me here. Working in Southern Oregon, I've had a terrible case of isolation away from the Hep C and the HIV world, so I'm really happy to be able to be here with you and recognize people by voices, but now see your face. So quickly, in a few minutes, try to tell you what we've done in the last couple of years. So we'll start out with that slide, and basically tell you who we are. So this is LaClinica, which is a federally qualified health center who started treating patients in 1988 when they opened their doors, the general public. And so there are 6 health centers throughout the county of Jackson County, 2 dental health clinics, there's a mobile health unit, and then there are 10 school-based health centers that we have. Last year, they treated 30,000 residents or patients in Jackson County. 53% of our population has Oregon Health Plan, and 65% of them are adults. So most of our patients are adults between 18 and 64 years old. So why did we start treating hepatitis C? I think that one of the reasons, as you all know, was the high incidence rate of transmission and also death due to chronic hepatitis C disease. But on a more local reason, locally, is we have a severe lack of providers who are treating hepatitis C. Pretty much, there are a couple who have a very, very tiny caseload, let's say, but the gastroenterology group or the specialty group was the only group that was treating. And our patients, when they were referred to gastroenterology group, did not make it, or they missed the second appointment, or the staff were all standing in a room ready to do a liver biopsy and the patient didn't show up. And so and then years would go by when there was a referral, and it was never brought up to our patients again, and that's for us to really take a look at. But if the gastroenterology group, if that didn't succeed, the primary care providers didn't have the information or the tools or the understanding of how to treat themselves, and so it didn't get brought up often. And there were so many other very urgent concerns. When someone who had Hep C came in for a visit, that was addressed, and Hep C was put sort of on the back burner. Recently we did do a data report. We don't have the greatest programs to be able to pull data as accurately as we'd like, but we came up from from those patients. We looked at who on the problem list had a diagnosis of chronic hepatitis C, and we came up with a list of 500 patients. This was the second time we had done this. The initial time that we did it in 2015, we had about 400. So we do have quite a number of patients. I'm not going to think that all of those are still with that diagnosis. Many have been treated. We've tried in the last years to sort of change that. But again, we don't have a sophisticated way to really identify our patients. So how did we get started? In 2015, one of the CCOs in Jackson County, and that was Jackson Care Connect, who does support LaClinica in many, many areas. And and I started working for LaClinica in August of 2015. I think they came about 2 weeks after I started working there and wanted to improve the access of care to their patients and pilot with us a program to see if we were able to do that in the primary care setting. So there was collaboration with the local GI consultants who were very happy for us to treat our own patients, and are still very happy for us to treat our own patients, because they don't have the staff to really support what our patients need, which is their behavioral health support and also their social needs that are going to help them be successful and adherent to their treatment. And then we had Dr. Zaman, who is also a consultant for us. So we came together, we met weekly on phone calls, and I would say it was probably about the month of October, probably for about 6 weeks. We had these weekly calls. We were also identifying patients. Of course, at that time, it was only stage 4 for Oregon Health Plan that met the criteria. We had until the end of December to get people on treatment. So Dr. Blanche is an internist that is treating hepatitis C, had never done that before. So he and I did what we could in about 6 weeks to learn about Hep C and started treating people in December. So we actually started 12 patients at that time. And we have been very successful in being able to treat patients. I think the ECHO, the program that came up, was a perfect timing for us. Again, realizing where we're at, to really have that opportunity to come together and review cases and stay on top of the latest. Dr. Zaman has always been available to us. I think for any primary care provider who is looking to start treatment, feeling hesitant about it, if you come and join those ECHO calls, you're going to gain the education and the confidence to be able to treat in a primary care setting. So other things that we're looking at as far as screening, and this is really where screening started. When you think that we have 6 different sites, in order to try to educate all the providers who are at that site, and that includes nurses as well, even though for EPIC is now bringing up on health maintenance not only Hep C but HIV screening as well, we're starting at our site to try to put that in place and then take it to the other 6 sites. We're also working with nurses who I met with last night to train them to try to also increase. You know, we're just looking at treating so Dr. Blanch and myself. So there's whole care for people who have hepatitis C and have had hepatitis C for quite some time and really need monitoring and have not getting the monitoring, and I can say that even from our own providers, and also post-treatment, the liver care that they need after that. So that's one thing we're looking at too, is an education group for the patients, but also this is really hard work to try to get this out to other providers and not just have ourselves be the specialty couple of staff who are at one of the sites doing all the treatment and all the patients are coming to us. I think it's really an initiative that's really important for us to, and our other providers do actually want to become more familiar with treating hepatitis C. The goal of that project was really to increase access for patients in a primary care setting, and then also educating the providers. So if we can go to the next slide just quickly, I have only a few minutes. When we're looking at successes, what we have is a team-based program. So we look at, although I probably do more of the work than you would in the team, ideally, there are many people who are involved in this. Primary care provider, myself, we have wellness coaches, behavioral health clinicians who also give some time and also some administrative support. Staff awareness of Hep C has increased, and again, I just want to focus on the ECHO, which has been really important for us, and some other providers who are interested have joined those ECHO calls, not just Dr. Blanch and myself. Actually, our whole team is on those ECHO calls twice a month. The challenges that we have is we do lack the support for the staff that we need to treat, so we're not treating as many people as we have waiting to be treated. And that's behavioral health support is really important. Jackson Care Connect had also provided us with a local pharmacist, and that we've not had for the last year. The funding that was being provided by Jackson Care Connect ended in the spring. And so we're struggling now to see what we can do funding-wise to keep this program going. And this would be an incredibly sad case if we're not able to continue to treat these patients. Another problem that we have is not access to a FibroScan. We do have the local GI group who provide FibroScan services once a month. It's not really public knowledge, but we happen to know since we were working with them. We still, though, cannot any longer get the FibroScans done. Their volume has increased on their own. Patients that I would have to have patients wait 3 or 4 months. So it's unlikely that we're going to be doing too many FibroScans. Also, this is very huge, is that there's no local organized public health messaging for Hep C awareness or prevention or treatment in Jackson County. We have patients who come to it, they don't know where to go for screening, they don't know that there's even treatment available to them, they have been put off and told, you're not going to meet the criteria, come back in 5-6 years, and they've done nothing to really address their hepatitis C infection. As a result of that, we have patients who their family members will not let them visit them. They think they'll get infected from them and won't let their children see these family members as well. We've had an employer recently who was requiring one of our patients who they found out had hepatitis C to get a note from their doctor that they didn't have to wear gloves and masks, etc., in order to come to work. This is unnecessary ignorance. And so, yes, we're rural, but we really need this public health message to come out, because that's where, and we've had some recent infections. We've had patients who have, for the first time, used IV needles. It was only for a short 2-3 months and are now infected. We have had someone who can tell me that they used needles for 17 times. And that's the only time, and that was about 6 months ago, and so they're now infected. So with no public health awareness, I probably feel as much energy putting into that as I do in us finding primary care providers to treat. So I know I've run out of time, and thank you so much.